Irregularities in cycle length and flow aren't a cause for concern. After being vaccinated against COVID-19, many people reported symptoms like swollen lymph nodes, COVID arm, and blood clots. These reactions can be concerning, as many of us have never experienced them before. Some of the side effects reported appear to be associated with your body's immune response to the vaccine. But what about the reports of altered menstrual cycles after vaccination? The evidence that COVID-19 vaccines can have a direct effect on menstrual cycles is still evolving. That said, several studies have shown an association between the vaccines and menstrual changes. Experts suggest that those changes are also likely due to your body's immune response and aren't a cause for concern. OB-GYN George Fife, MD, FSC OG, shares his insight about why this might be happening. Research on COVID-19 vaccines and menstruation. Talk about the connection between vaccination and menstruation has been happening since COVID-19 vaccines became available. Interest grew following the publication of 4 different studies to examine the relationship between the vaccines and periods, also known as menses. The other 2 looked at the relationship between the vaccines and the entire menstrual cycle. Then, in June 2023, the National Institutes of Health NIH released the results of a 5th study. The data came from a broader project, Boston University's Pregnancy Study Online, also known as PRESTO. The sample size of the PRESTO study was small, but all of the participants were attempting to conceive at the time. In other words, none of the people studied were using any kind of birth control. That made the data the researchers analysed cleaner than it was in previous studies. COVID-19 vaccination and menstrual flow. We'll start by talking about menses, the period itself. A study published in Science Advances in April 2020 shared the results of a survey about menstrual bleeding following COVID-19 vaccination. Of the 16,000 menstruating people who responded, 42% reported bleeding more than they usually do during their period. Interestingly, people who don't menstruate either because they're postmenopausal, on certain long-term contraceptives, or taking gender-affirming hormones also reported breakthrough or otherwise unexpected bleeding. 42% is an eye-popping number. It's also probably inaccurate. That's because a person's more likely to respond to a web-based survey about their menstrual cycle if they've noticed something unusual about it. The findings of a January 2020 study out of Norway were less dramatic, with only 13% of respondents reporting a heavier than normal flow. The picture became a bit clearer in June 2023, when the PRESTO study analysis found no significant relationship between COVID-19 vaccination and heavy menstrual flow. They didn't find a relationship between vaccination and menstrual pain either.